One of the most common sporting injuries we see in a private practice is a good old-fashioned sprained ankle. And I'm going to show you today how to tape an ankle, which is very handy because it's commonly injured in netball, football, all sorts of running sports. The most common presentation we see is when the ankle joint is stretched in this position and the three main ligaments on the outside of the ankle become stretched, sometimes partially torn, but certainly unstable. The aim of the tape is to hold the foot and the ankle joint in that position, protecting the ligaments, allowing them to heal and providing some stability around the ankle joint, allowing the athlete to continue playing even though the ankle might be a little bit unstable. We can use some strapping tape very easily at the start to put what's called an anchor around the top of the foot, top of the area there, and that provides the base where we're going to run most of the tape from. The most simple form of taping the ankle is to add a couple of what's called stirrups around the outside of the ankle. We start with our tape, place it on the inside of the ankle, wrap it around lightly, and then wrap it around the underside of the foot. And this is where we add a little bit of tension into the tape. And we bring that across, just tear it off, push that down very gently, and you can see that that's where that tape is coming up and starting to mimic partly where that ligament is. We can then run another one slightly behind and across, again pulling up a little bit, holding that there, making sure it gets nice and sticky onto the skin, and perhaps one more just to make that nice and secure. So that would be a nice, simple, gentle ankle tape. If you're looking to add a little bit more into it, I personally like using heel locks. They're a slightly different taping technique, and as the name suggests, you're actually locking the rear foot or the heel into place. This time we're starting onto the top of the foot and we wrap the tape around, capturing the back of the Achilles tendon, wrapping around behind the heel and then laying it up that way. The advantage of this tape is it allows the midfoot and the forefoot to move nice and easily. We're not locking down this front part of the foot, so the athlete can still run, flex the foot, point and do everything they need to do. We then add another heel lock, this time starting at the back, running it around, grabbing that back part of the heel and wrapping it up and finishing over the top of the foot. Just adding a little bit of tension onto there. So you can see that most of the side of the ankle here is captured by the tape. It stops the foot from rolling in this direction, but still allowing the athlete to bend and flex their foot in this way. Once you've done that, very simply, we can use a couple of strips of tape just to close this down, wrapping it around, trying to grab any little, this is a very good example, a little bit of bare skin that might be sticking out behind there. If you leave that there, the skin will work its way through the gaps in the tape, quite often causing tears. So just closing that over, have a good look around, make sure there's not too many main creases or little pockets left anywhere. And then this little triangle piece at the front, I always like just a little bit of tape up there, covers that off and it stops the skin sort of finding a little corner point. Laying that down, just checking with the athlete that they're fine, it's not too tight, they've still got feeling in their feet and their toes, then they're good to go.